Honey, you have a heart.
Barely, but yes. Yes, I do.
Hi everyone, my name is Peggy. I'm an emergency medicine doctor and this is my husband.
Hi, I'm James. I'm internal medicine.
Thank you so much for watching. This is episode 8 of the series and I plan on finishing the whole series. So thank you for being patient. We have actual full-time jobs and we've been also spending time with our families and going on vacation, which has been really nice. If you want to find me on social media, my Instagram and TikTok is here below. And otherwise, let's get to episode 8. Go ahead.
Right.
Didn't I say she's going to go right back to work with a miscarriage?
Yeah.
This is unfortunately what we expect of ourselves, and there's just a culture of not calling out work because then some other doctor has to replace you. There's not like a infinite pool of people to help out when you are not there. Oh, she's ultrasounding herself at work. I have definitely done this when I was pregnant, both times. Ultrasound myself at work.
Grab 20 Librium, there's only 10 left. Where'd the other 10 pills go?
I don't know, maybe lost, stolen, maybe sold them to buy the vodka.
I don't prescribe Librium routinely to discharge patients with alcohol withdrawal.
Yeah. I do it sometimes from the inpatient side.
Yeah, it's hard because it's a controlled substance. It's to prevent alcohol withdrawal. It's good for treating alcohol withdrawal, but if mixed with alcohol, it can be dangerous. Can also be abused. Can also be sold. So it's tricky.
Yeah.
Her mercury level sky high from that face cream. I ordered chelation, TID, 10 per kilo of DMSO.
Now that is rare. I have never seen a true mercury poisoning.
Yeah, me neither.
We learn about it, but it's very rare.
I didn't even know that you could do it from skin contact.
Wow.
What happened? I couldn't.
It's a ring.
That's a tourniquet, right?
What is it?
Or is that the ring that's
Where's
stuck?
the missing piece of skin?
It's under 1,000-pound unit.
Call plastics. Oh, ER does not do this.
Well, they rauncher it.
To
They what?
close the wound, we're going to trim down the bone, then use a plastic surgery trick so the skin will cover everything.
Okay.
But you don't do that in the ER, do you?
Depending on some far away ERs, some ER doctors will do it themselves. I don't. We have call it an ortho, but some places they can do it.
Wow.
I don't think it technically takes much skill. You're just taking the leftover bone and shortening it a little bit, using the skin to cover it, to close it.
What do you mean you shorten the bone a little bit?
If you get your finger cut off by accident, and
Oh, you take the bone that's...
the bone is already sticking out, right?
Right.
It's like right there at the skin, so you have to shorten it a little bit so you have enough skin to cover it.
But
Yeah.
is his...
Yeah,
his
I think
finger?
so.
Oh,
Like
I
he was
didn't-
saying, like the part is missing.
Oh, wow. I didn't even see that.
Yeah, I think we couldn't see that, but either way, it's
Got
a
it.
myth
That makes
that
sense.
you can reattach most fingers. In fact, it's very, very rare that you can reattach a finger. So most tiny little fingertips and stuff like that, and if they're like bad candidates, they don't just get reattached; they just get closed up, and you just have a shorter finger.
Yeah.
But it's still a good idea to bring it to the hospital, wrap it in wet gauze, clean wet gauze or clean paper towel wet, and then put that on ice itself. Don't put it directly on ice because that ice can cause too much ischemia damage to the amputated part. And then you bring that to the emergency department.
All right.
The more you know.
Pacemaker patient with dementia, heart rate at 30, little altered with a systolic at 80.
What's your plan, Dr. Lang?
Second mig of atropine now, push dose epi 0.1 milligram, portable chest.
31 on the monitor.
We can try percutaneous pacing, but eventually we'll need transvenous.
Systolic's up to 95 with the epi.
It's too low.
Well, there it is.
How far down?
Just so the sub-Q will cover.
So the V becomes a Y?
Exactly.
That is I've never done that.
Mm-hmm.
Yeah, I mean, it's usually we call a specialist like orthopedic surgeons to do that procedure, and it's not actually even really emergent. Like they could wait till the morning to come in or something like that. It's just to basically complete the amputation and close it up. But I guess in certain emergency departments like this one, or if you're in a rural area with like there's not much access, so there's not many doctors in the area and you're the only one there, then they could do this. But honestly, it's not part of the emergency medicine in the American medical health system training or required.
Yeah.
Yeah.
I've never seen this in ER.
Yeah.
Your pacemaker isn't working. We're going to try to pace your heart from the outside. You might feel it in your chest.
Transcutaneous pacing.
Yeah.
Oh, Y'all trying to
Case
electrocute
off.
me?
Can't tolerate it. One of Verse said, can we set up for transvenous?
We need to float a temporary pacemaker from your neck into your heart.
Because your heart rate is only 30.
So yeah, what they're doing is basically what we like to call in medicine symptomatic bradycardia. So bradycardia means their heart rate is too slow, right? What's a normal? Like, do you want to tell them like normal heart rate and all that stuff?
Yeah, I mean, as long as you're perfusing well, but typically at least 50. If you're a super athlete, you can be okay in the 40s, but typically 30s is too low.
By the textbook, a normal adult heart rate is 60 to 100. That's by the textbook. Some people are lower than that, like he said. And this guy has a heart rate of 30. That's 30 beats a minute, and so it's super slow. There are some rare people that will be fine like that, but this guy, no, his blood pressure is way too low because his heart is beating way too slow. So the way we can treat it is with medications. They're talking about pushing all these medications, and then in extreme circumstances, we can use electricity and shock the heart, or what they're doing is they're pacing the heart like a pacemaker would, but actually, like they were saying, through the skin. So we put like the sticker, same things we use for shocking in cardiac arrest, but we put the stickers on the patient and then they shock it through a machine that is specifically made to pace the patient. And that's, we do that. It's not super common, but it's not that crazy rare. It happens. And then they're talking about putting in something it's not more long-term, but it's just a little bit more comfortable for the patient, I guess.
Yeah, it's more comfortable and it's more reliable.
Yeah, they're talking about putting in, instead of only just doing externally pacing, you can also do a procedure where you go in through the big vein, and it's on this side usually, and you go down, you put a little catheter in has the pacemaker tip into it, and you float it into the heart, and then you control it with a remote control on the outside to pace the heart, and then that way the patient doesn't feel the shocks through the skin like they normally would.
Yeah.
And that, again, is still just a temporizing measure until you can get to a formal pacemaker, which we've done those things.
What do you think about having some help at home?
Medicare will cover short-term home care, at least 10 hours a week.
So for all the people who don't like robots, it'd be very helpful in a situation like that.
What would a robot do in that situation? Watch your family members?
Yeah, just watch the family.
Robot babysitters?
Robot babysitters.
James here is saying it first.
Yeah. No, I'm like, not abandoning them, but everyone needs a break for like an hour or two,
Well, I think adult daycare is a good idea too.
Yeah, adult daycare is a good idea, but not everyone can afford it.
Yeah, that's true.
If you,
But a robot might be more expensive.
they wouldn't buy the robot. It's like if you just have like, essentially once you have the robot, it's like free by the hour after you pay for the initial. So it's like a service that either insurance can cover or Medicare Advantage or some other service.
Pacing box rate of 85 milliamps.
Confirmed on ventricular setting.
Passing to 30 just outside the heart. Looking good. Check the pulse.
Strong radio, really strong.
This is a pretty cool thing that we get to do. It is pretty cool.
Yeah.
Systolic's up to 130. How do you feel?
Yeah, like $1 million.
Oh, geez, I still need to tell Nandi about her mercury level.
The average emergency doctor gets pulled from task A to task B every 3 to 5 minutes.
Remind me again why we picked this specialty?
Because we all have ADHD and anything else would be boring as hell.
Oh my gosh, that's so true. Like, I'm constantly being interrupted in anything I do. Like, I'll be doing one thing and one person needs this, someone needs this, multiple patients need this. And like, I can never be truly fully on one task until the very end. But that's just emergency medicine. And why did I pick it? I don't know.
Because you have ADHD?
I don't think I have ADHD. Although I do like things short and to the point.
That's everybody.
No, but me more so. I'll be like, tell me the end of the story before you tell me the story. Right? I do that.
Yes, you do.
Yeah. But anyway, but I am a very patient person in general, which is not that typical. I'm more patient than most.
Yeah, you are.
Amber Phillips, 6 years old, found at the bottom of a home pool with an unknown downtime. Asystole on the monitor.
Oh no.
Intubated with a cuff 4.5, 22 gauge left AC, 0.25 epi 3 minutes ago.
1, 2, 3.
What was the cause of asystole? They don't know.
Drowning victim, found in the bottom of a pool.
Oh, found in a pool.
And she's 6 years old, just like our little girl.
Moderate hypothermia.
We need to get her up to 90 if we have any chance of restarting her heart.
250 cc's heated saline. Set up the Arctic Sun, continuous core temp monitoring.
And prep another epi 0.25.
Yep.
Give me some Dilaudid.
Okay, 1 milligram Dilaudid.
I need 2, sometimes 4. If you want to help me, give me my doctor, Dr. Shamsi. I don't want to talk to anybody else.
Is that her mom?
Surgery right now.
Is that what?
Is that her Shamsi?
I don't know.
Ma'am, right here we have
Dr. Shamsi's daughter, Victoria.
Oh.
That's it.
My wife and I decided we're on board with organ donation.
Oh, I'm really glad to hear it.
The church supports their decision.
The OPO is sending an ambulance.
I'll be staying with the family.
How's it going in there?
Not good.
For the little girl in trauma 1, this is Grandmother Frances and Sister Bella.
Hi, I'm Dr. Rabinovich.
Let's do it. Come on.
They are still doing CPR.
Can I please see her?
Yes, of course. Got Grandma coming in. Let's sit right by the bedside.
Ready to switch?
Go.
Here you go, ma'am.
How long was she down for? We don't know.
They don't know. They found her at the bottom of the pool.
Oh.
They found her at the bottom of the swimming pool.
They moved a bench
Yeah.
next to the pool fence so they could go over. Because their soccer ball went in the water. Amber couldn't make it out the deep end.
The gate was locked. I was vacuuming. I didn't hear them.
She got pulled from the pool.
She wasn't breathing.
Rhythm check, hold compressions. Asystole, resume compressions.
3 minutes since the last epi.
Push it.
How long would you go with CPR for a case like this? Where it's like 6 years old but also not good.
You gotta jump them.
A long time. It would go a long time. It's really hard to lose a kid.
Okay, so we gotta warm up. We gotta get some more
Yeah,
blankets
pause.
in here or something.
You can feel these blue pads. They have warm water running through them like a hot tub.
Are you sure you're doing everything?
Yes, we are.
Minimal relief with 2 of Dilaudid.
She needs 4.
That's what I've been telling them.
We're titrating. We didn't want her to stop breathing.
How's the exam?
Rigidity with guarding.
Sounds like peritonitis.
Ready for some more Dilaudid?
Those are huge doses of opioids.
Yeah, that would
huge.
That would probably kill.
That would definitely kill both of us. So
Yeah.
this person is very opioid tolerant.
Yeah.
She has a high threshold for opioids.
Yeah.
I've been on 2 cases with Langdon, and there have been irregularities with benzos. Lorazepam with a seizure, Librium with an alcoholic. That he could be stealing.
See?
Yeah. I probably wouldn't like jump to major conclusions just from
Yeah,
that.
I mean, honestly, I don't know even how my first day of the ER I would even notice that. Like,
Yeah.
you're just like so lost in how everything else is going on. There's like
Yeah.
only like a really seasoned nurse would notice things like that.
Right.
I mean, not to say it doesn't. These things do happen.
Oh, it definitely happens.
So
But,
be interesting if it is true.
Yeah.
She's very observant.
yeah, but I would need like I would have to be like way more sure than that to like
Oh,
be
yeah.
like, hey, do you think?
Piper, are you okay with your boss being here while we talk?
She doesn't mind. We have no secrets.
So burning with urination. When did that start?
About 2 days ago.
Why don't we let Piper answer the questions?
Is she the patient, but she's making her assistant be the patient? She's like probably
Maybe.
asking about her own symptoms, but she doesn't, for some reason, I don't know why, want to
Yeah, it's
register.
Yard work. Moved some firewood. I might have got a splinter in my foot. I wasn't wearing socks.
2 small puncture wounds 1 millimeter apart.
Oh, Black Widow spider bite.
Mm. But that would leave a much bigger mark on the foot.
No.
You think it would just be that tiny?
Yeah. That she's got a rigid abdomen from it. That's like classic for her.
You're shitting me.
Red hourglass
Widow.
marking.
We need IV diazepam. Start with 5. Might need 10.
Good job, med student.
Yeah. Also, med students can't order diazepam.
Right, med students cannot order meds. Definitely not controlled substance meds.
Yeah.
You have any family you want to call?
I don't have a phone. She can use mine if she needs to.
Oh, she's like a groomer.
She's getting trafficked.
Oh, she's getting trafficked.
Yeah. I think that's what it is.
Mm.
Like a madam, and she's the.
Mm.
It's suspicious because like the boss won't leave her alone.
Yeah.
And the fact that.
Piper, do you want some privacy?
No, it's cool. She can stay.
That's like the first rule is you don't ever ask the person if they want the other person to leave.
Right.
You just make the other person leave
Yeah,
because
you have to make the other person
because
leave.
the person getting asked feels awkward saying in front of them like, no, I don't want my boss or my parent there. You know, you just have to be like, oh, as a doctor, like I have everyone step out so I can examine them, and they just like
Like,
objectively.
Yeah, it's
move
our
them
policy. We can't have other people
Yeah.
in except for the chaperone. And
Right. I just separate them to just talk to them, and just make up some excuse because the person themselves can't be like, no, I don't want that person there, because they're worried about the repercussions.
Yeah.
So that's something we actually do learn in medical school
Mm-hmm.
about like pediatrics, adolescents, like any kind of sketchy situation where this person's not leaving this person alone.
Yeah.
Core temp is 88.
It's up from 85.
Too cold.
Yeah.
She's very, very cold temperature. She's much lower than normal body temperature. I mean, they could be doing CPR on this kid for a long time.
Yeah.
Because the rule is like you have to have them close to body temperature to
Yeah.
pronounce somebody dead.
Yep.
So it could take a long time to warm up that kid.
Yeah.
And you don't want to prematurely pronounce someone dead if you can, like, you know, warm them up and stuff.
Right.
So
When he was a kid, he was a medic for the Freedom House ambulance service.
Back in the 60s, no 911, no ambulances. Then this doc from Pitt, he got some money and trained us up.
You're moving your old pacemaker.
Oh, he kept moving, and that's why he got dislodged.
Spinning that thing around caused the wires to break off.
Yeah. Put in a leadless.
A CT scan of your kidneys.
I'm sorry there's radiation. You won't be able to stay with her, but we'll be back as soon as the scan's done.
You're good with this, right?
Yeah, I'll be fine.
Oh, that
and
lady's
she's pregnant,
so maybe
too?
she's also a traffic key. I don't know who knows.
I don't know.
This is where you do the CT?
No. Piper, you have any concerns you want to talk about?
91 is warm enough for her heart to respond.
Oh, compressions. Asystole.
Resuming compressions. Got the potassium level back, 12.2.
Whoa, that's sky high potassium.
Whoa.
Basically means she's dead, right?
Yeah.
Because all her cells are like
Yeah.
dying and releasing potassium.
Yeah. I mean, that's the only reason.
I am so sorry. Amber has died.
No, 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 it's not happening. No, 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 no.
Before we stop, do you think her sister would like a chance to say goodbye?
Oh man.
I shouldn't see her like this.
Yeah, there's no way I would let.
We are going to stop now. Resuscitation efforts discontinued, 1451.
That's hard to watch.
Yeah.
How are you so okay?
I don't cry that much during movies.
He's like, it's just a TV show.
Yeah. I mean, I know that the kid's not really dead.
Yeah, I guess. I mean, obviously, I know it's just a show, but I'm crying because I'm reminded of things like that that we've had to take care of, like losing pediatric patients and seeing drowning victims. And drowning is actually one of the most common causes of death in children, young children, in our country. Car accidents is another one. It's trauma and drowning. So we're like really crazy. I mean, I am very. You only have to see one of them in your lifetime for it to be too many, and I've seen more than one, not just drownings, but just children dying of other causes, and it's horrible. And so, like, I'm crazy about pool safety, and please, if you guys have kids, like, make sure your pool is extra safe with multiple barriers of precaution. We have like an automated pool cover that's locking with the code, and we have swim safety survival lessons for our children, and we have alarms on the doors, and it's still like, you know, you still can't be too careful because it is a silent, quick event. In the matter of like 1 minute, 2 minutes, you can lose your child. So, and it's not just swimming pools. I've seen it happen in bathtubs. So never leave your child unattended in a bathtub if they're young. And I'm just scarred from seeing things like that and hearing stories like that. And it's just hard. And if I was the doctor running that case, I mean, they did a great job. They did everything they could, but obviously I wouldn't be like this at work, you know, like I have to like hold it together like Dr. Robbie does, and we like do our job. You have to turn off your brain. You just think about the medical part of it, and then you let the family be there at the bedside. That's like a nice thing we can do for patients in these situations when there's like a prolonged CPR and resuscitation. And I mean, I just think as the professionals, you don't want to see the doctors breaking down. Obviously, you want someone has to be calm in the room, and it better be the doctor and the nurses and everyone else. But afterwards, when we go home, that's when we cry. Or when we sit in our car, that's when we cry. When we leave the room, we go outside of the ER, go to the bathroom, cry. We just can't do it in the room. But it hurts us, and we remember it. And yeah.
She saved me. I fell in the pool. She helped me get out, but then she couldn't get out. I'm making her a card.
Oh. Are you surprised?
Yeah.
Are you okay?
I'm okay.
I've heard of, that's another thing that we should tell kids, is if you see another kid falling, like, just get a grown up. Yeah, get a grown up. Our swim survival teacher taught our children that, so we should reinforce that to our children, is if a young kid sees another kid falling, don't try to save them.
They turned out the very first medics in the United States.
We started IVs, defibrillated, intubated in the field.
We're the heroes of Hill District.
Bunch of young black dudes saving lives every day. Their program created the 911 system.
I've heard that is an actual, like, historical, real fact. There was like
I believe it.
Yeah, they're featuring what is it called, Freedom House? It is true. I didn't know about this until the show also, but it's great that the show is teaching us about the origins of our American emergency medical system. They're the first EMTs, or like the basic paramedics of the country, and we got that from really brave Black individuals, and so that should be recognized as an important part of Black history and all of American history.
If you tell Bear everything you want to tell Amber, then I'll take Bear and sit her on Amber's pillow, and then she'll tell her everything you said.
Hi, Amber. It's me, Ella. Thank you for saving me. I promise I won't touch your toys without asking. And I try not to fight, because you're my best friend in the whole entire world. I love you.
I'm a mess. I'm a mess. We have 2 little girls.
They're best
How long have you been working here?
32 years?
All in the ER?
Yeah, I like taking care of everyone, especially the ones who fall through the cracks. They got nowhere else to go.
Well, you deserve a medal.
Honey, you have a heart.
Barely, but yes. Yes, I do.
Thank you for everything.
And where are they all going to this funeral?
He's an organ donor. That's why they're doing like a lineup and letting him parading, and like they're all going to honor him because he's donating his organs for other people.
We've never done that before.
Well, this is the thing that people
like
do.
ER thing?
We don't do it commonly from the ER because usually most people aren't organ donors, but I've seen them. We've lined up for people that are coming from in the hospital and going out of our hospital. We lined up for them.
Okay. I mean, we've had organ donors and like collections before, but like.
And I've seen this on videos of like pediatric hospitals, a pediatric kid, and everyone's lined up for them. We did it for like a casket, though. We didn't do it for like an organ donor. We did it for someone in the emergency medical system that passed away. So
interesting. Man, I would go to one of those, but
Like, I think we would line up if anyone was like someone that we, you know, if it was one of us, or someone part of our system, or someone like that, like an organ. It's like a sign of deep respect.
Right. That makes sense.
Yeah. All right. How are you doing?
Doing okay.
That was hard.
Yeah, that was really hard.
I knew that was coming because people have warned me. And I didn't want to say anything, but I think that's like one of the harder ones.
Oh yeah, that's pretty bad.
There's not many things worse than a child dying. That's probably one of the worst things ever of our job.
Yeah.
Yeah.
Yeah. When I was a med student, I had like a 10 or 11-year-old die. Like, it was a student that, like, basically cried throughout the entire, like, rounds. They had to, like...
Who cried?
Me.
Oh.
Yeah. And then from that moment, I was like, I can't do pediatrics. It's too sad.
It was like a very sick pediatric patient that was in the hospital.
Yeah, exactly. Like, I was following them for a while. It was like...
And you got to know them and stuff.
Yeah.
That's horrible.
Yeah.
And then you had to leave rounds because you were crying?
Yeah. It was like, it was pretty bad. I was like, I was disrupting rounds, I'll put it that way.
I've never seen you like that ever.
Oh, I mean, it was a kid who died.
Of course.
Mm-hmm. Like a myodystrophy case. So it's like...
Yeah.
But anyway, yeah. Adults dying, you kind of get over it, but like the kids dying, it's pretty bad.
I mean, I've cried over some adults dying too. It just depends on the situation. The point is, like, but pediatrics are probably one of the worst. I actually really loved pediatric emergency medicine, and I thought I might go into specialty into that. I chose not to just because I wanted to be done with training, but pediatric emergency medicine is pretty amazing, but that could be a dark side of, you know, pediatric ICU, neonatal ICU, any like pediatrician that's in the hospital, deals with dying children, but also pediatric emergency medicine. I am a wreck because our child is exactly 6 years old and we have 2 daughters and swimming pools, but also just thinking of kids that have died, and that's really hard. They didn't have the parents like screaming and crying in this episode, which normally is what we hear.
Well, they were screaming and crying a little bit.
No, it's everyone that works in the ER knows, I'm sure in the ICU too, that wail, the very distinct wail of a mother who just was told that their child died. Sorry. Have you heard it before? Mm-hmm. Yeah. Like, it's heart-wrenching and so hard to watch someone grieve for their child like that. I hope most of you will never hear it, but we hear it at work often. And one of my friends told me she saw a mom that had their kid died. They had a case where a pediatric patient died, and my coworker, she was like, one thing that really stuck out to her was like, the parent was holding the baby's onesie and crying into the onesie. Anyway, really horrible things, losing kids. I had also like a couple years ago when our daughter was 3, I had a kid come in that was exactly her age too.
Yeah.
In cardiac arrest, and luckily we got the patient back, but it was still wasn't a good outcome, and it was horrible. Yeah. So everyone, like the way the whole department kept running during that pediatric department, it's not usually like that. Usually when there's a pediatric like cardiac arrest, everyone else drops everything and everyone goes in there, and like everyone else like everything else stands still for this. I mean, unless like, you know, like sure, a gunshot wound comes in or something, like you have to deal with it, then someone else breaks off, but everyone is in there because, and we'll keep the full team working on that until like there really is nothing else, because no one wants to give up on a child. And so people, I've heard colleagues like an hour, you know, more, sometimes an hour and a half, like still just doing CPR, just trying, and usually it's just a very bad outcomes if it's been that long, and if you do bring them back, it's usually not back to a normal brain function, and it's just sad.
Yeah.
All right, I'm done crying. I'm done.
Okay.
Sorry, I made you cry.
I know, you should have gotten a guest star.
Oh, not you?
Yeah.
I haven't seen him cry in a very long time.
Yeah.
Well, the Pitt, you have done it to us. You have done what you tried to do. You made us hard, cynical, walled off healthcare doctors cry. So that was your goal, was to show other people how hard it is in this job. And thank you for showing this hard stuff. But I'm good with that episode.
Yeah, that's good.
All right, then. Good night, guys. Episode 9 will come eventually.
Halfway.